All right, Patty, I'm coming to give you some of my thoughts on RA. Hopefully you can use bits and pieces of this. I think it's important that you do your own research, and I think it'd be awesome if you'd actually print out some photos from the internet. I know that they're not fun to look at, but it's really about there being a direct connection between some of your friends and fellow classmates. I sometimes think that they don't get it when you're just kind of describing something to them. So sometimes when you show them a visual representation, it might sink in a little bit more. Like they'd be like, what? Yeah, right? And let's be realistic. The pictures are very hard to look at. Okay, I've been looking at them for almost 30 years. It's very, very hard. But again, remember that just because you're seeing it on the computer does not mean it's going to happen to you. All right? Like, I want you to make sure and you take that with you. Because you also know that I was diagnosed at 16 and here I am now at 45, probably older than your mother and your dad, but old enough to be your mommy. So things can happen, right? Like to all of us, all the time. But it's important we focus on the positive and not what could be there. Worry does us no good. All right, sister? So don't be thinking about any of that stuff. I want you to concentrate on where you are and where you're going to go, right? Because you're going to do big things. And it's going to be hard sometimes, but you can do hard things. All right? So remember that. Okay. So let's start with short and simple. First of all, you don't want to bore your classmates, so you want to just get to the point real quick. And, and a lot of, people at, 16 years old don't really have that much of an attention span or really care because it's just, that's the society we live in. So to make it really simple it's important to say that rheumatoid arthritis can affect anyone at any age. And then you can go into your story, right? And you can explain to them that you were diagnosed with rheumatoid arthritis. It is a chronic inflammatory disease, right? It's an autoimmune disease. It can affect any joint in the body. It primarily goes after your hands and your feet. I mean, that's very, very typical. But because it's autoimmune, it can affect any joint in the body. And let me be clear that the first surgery I ever had was on my jaw. But I will tell you that the significant pain was in my elbows, down my arms, in my hands, and in my feet. Like I could not put weight on my feet. It was terrible. So it does affect the major joints of the body. It can also affect the major organs, which is what I talk about quite a bit, right? Your heart, your lungs, your kidneys, your liver. It can affect those. It can also affect your skin. So it's important to mention that, all right? Within your joints, there's a lot of pain, swelling, and stiffness, right? I'm sure that's how it started for you. And usually what happens on one side happens on the other, which is called symmetrical. So it is a symmetrical disease. I had an arthrodesis of my left wrist in 2014. So I don't have a function, right? I don't have function in my wrist. Can't move my wrist. They took 60% of my wrist away. They also took the scaphoid away. Now, I'm telling you this because because of the symmetrical thing. Eventually, I will have to take out my right wrist. I'll get it fused as well, eventually. Hopefully later down the road, but you just never know because you just never know what you're gonna wake up like tomorrow. But the interesting thing, and I'm happy to send you a picture of this. If you want me to send it to you, I can send it to you, or I can actually tag you in a post I did a while back. This was prior to you following me, where I talked about my wrist removal surgery, and I actually had pictures of the surgery on my Instagram. I still do, they're there. They're just buried very deep with all the posts I've done. But when they took out my scaphoid, which was the little bone here. So I have it over here still, right? That's your scaphoid, that round bone right there. It was supposed to be all nice and smooth. Well, when they took mine out, it was like in a chunk and rigid and wasn't good. Because with rheumatoid arthritis, we have synovium at our joints. And what happens is our immune system sends antibodies to that synovium and causes an inflammatory response. And that's why when you're inflamed, damage is occurring in your joints. So if you have pain, red, and stiffness, that's when you have to be very careful to decipher what inflammatory process pain is versus like working pain. Okay, I really want you to take note of that. Because you're working out, which is awesome. And you know I love that because I love to work out. But you have to really recognize if that pain, what that pain is associated with. Because we don't want there to be an inflammatory process going wild in your body when you're trying to push through a movement that could affect a joint. Because what happens is when that synovium is inflamed, it's damaging all the cartilage and it's creating a bone-to-bone situation to occur, right? And that sucks, okay? Because we need this nice and glide thing. But when you have RA, what happens is it makes it impossible because the synovium that was used to helping us move our joints freely and without pain, because there was nice fluid in there, gets destroyed, and then you have a hard time moving through it. Okay, so that's really, really important because that's a key component of RA. And when you damage the cartilage, the synovium, next thing you know, that's when the deformation occurs. And if you do Google images of rheumatoid arthritis, you see, I call it the disease that, my body folding in. And that's because of the images that I see online and stuff. And, you can see like my hand is turning, right? You can see that. So my joints are falling inward, right? So that's why I call it the folding disease. It's kind of a derogatory term towards the disease, but I think you know what I mean. What else could I say? I do want to point out that because I was diagnosed so long ago, the treatments have improved significantly. So back when I wasn't, we didn't have cell phones back when I was young or your age at all. So I couldn't record all of the history back then like I do now. Like obviously I take lots of photos and I really try to give you a clear understanding of the life that I live while living with this disease. And, a lot of people are like, oh, geez, she's a badass, but, which is great and a great compliment. But in reality, that's not what it was like for me at the very beginning when I couldn't get out of bed or I couldn't walk to the bathroom by myself. I've been on walking canes, I've been in a wheelchair, I've been on a scooter, I've had a cane, I have it all. And what's happened because there's been such advancement in medications is it's now made a crippling disease easy to manage. So RA has been crippling for years. And when I was first diagnosed, my first rheumatologist told me that I'd be in a wheelchair by the time I was 21. I'll never forget that day. Now, I went down a very, very bad and dark path because of what he said. But in reality, I'm actually glad he said it because I used it to fight and to be where I'm at today. So I think it's important to talk about that on how the treatments that they use today, I think this is another key point, is that these are cancer drugs. So methotrexate is an old chemotherapy drug. Rituxan, obviously, which is the drug I'm on. They use it today for lymphoma patients. I am on that drug because the disease is in my lungs, and which opens me up to a number of other serious diseases. I am currently dealing with, IPF, which is pulmonary fibrosis. So hopefully that helps. I don't want to make this too long. It's like 10 minutes, but it's a balancing act. And I think it's just important for you to talk about your story, like be open to talk about your story. And if you're comfortable, you can talk about me all day long, but I would really like for you to put this in your words. But like I said, I'm happy to send you any pictures you want or anything. Hopefully this helps. Another thing, obviously the disease does not discriminate. Okay. So it is more prevalent in women than it is in men. So, but you can get it at when you're born. You can get it at 5. You can get it like me and you at 16. And you can get it when you're older, right? So, but it is not an old person's disease. And I think that is really important. And I'm so glad that you're doing this. So listen to this. Ask me any other questions, okay? I'm proud of you. Whatever you do, you better go up there and make it count.